Hello, I'm Dr. Dennis Courtney once again with you. I am the Medical Director of Stem Cell Solutions of America. We are located in Zephyrhills, Florida and Pittsburgh, Pennsylvania. We deal in the treatment of various medical issues with an exciting new offering that is becoming very widely known in the United States. And would like to take this opportunity to educate you to become aware of stem cell corrections and how to select stem cell products that may be presented to you. I'm inviting you to a discussion that allows you to find a solution to your particular medical and health dilemma. As we advance in age, and every one of us is confronted with medical issues, up till now, they never can be completely resolved. On one case, we can be managed by our medical doctors through the use of various pharmaceutical preparations. And that may be able to alleviate our symptoms, but it in no way is able to reverse the disease. There are other cases, by the way, for which, because of any particular disease, there may not be a treatment protocol at all for it. And in that case, the progression of the disease determines how rapidly the disease moves down a highway without a very pleasant ending in sight. Now, in my presentation to you today, it is my intention to try to show you how stem cells can maybe accomplish that which you would hope they could do. My intention is not to try to sell you anything. Instead, I want to educate you about this exciting new treatment and a treatment option that can be provided to you to restore your health. Now, the final point that I make as we begin our slides today, a slide entitled Stem Cells 101. These products that we're going to be explaining you have been developed with the ability to correct medical issues that have never been correctable before. When we're said and done today, when we've completed our task today, you will be the educated consumer that you need to be to make a medical decision that could change your life. And it's with that in mind then that we proceed through a series of slides to explain that story, keeping in mind too that as we get to the end of our discussion today, we're going to be leaving you with a 7-point checklist, which will allow you, carrying it in your hand, to be able to scrutinize any product claiming to be able to help you and make a decision as to whether it is in fact the best product that's available in the marketplace. So with that in mind, we now continue. So as we begin our presentation today, entitled Stem Cells 101, How to Become an Educated Consumer in the Medical Decision That Could Change Your Life, let's see how our story unfolds today. The first thing to bring to your attention is something that maybe doesn't need to be brought to your attention at all. And that is the issue of stem cells has made it into the media. You've seen magazine articles written on it, newspaper articles doing the same, various other forms of media describing what I believe to be the hottest medical topic of the decade and actually going to lay the groundwork and the foundation for what I believe to be the most important part of medicine that we've seen in the last 100 years. A little bit about myself to familiarize you with me. I started this all off my careers as a high school teacher a number of years ago. After a number of additional careers, off to become a medical doctor and an anesthesiologist. Ultimately, however, walking away from that operating room about 20 years ago, moving into an office practice and treating people without the use of pharmaceutical preparations of any kind. I have been the past clinical director of an anesthesia department, I developed the Courtney 3-step program to regaining your sight, and hopefully maybe be able to talk to you about that sometime if you have eye afflictions of a serious nature. I'm the host of a local radio show that I've been doing for over 23 years. I'm also the past program director of the Healing the Eye and Wellness Center in Zephyrhills, Florida. So with that bit of background out of the way, let's get off to the topic at hand, entitled, What are Stem Cells? Now, the highlighted points are quite accurate. These are cells that can be harvested that haven't fully declared yet on what tissue type they will ultimately become. So you administer them as a doctor, they land on certain tissue, and then once having landed, determine to become the cell type of the tissue that they land on. Now, in this next slide, we see represented a number of possibilities, but this is just a mere pittance of the possibilities. Things like stem cells can turn into cartilage. They can turn into brand new healthy bone. They can turn into healthy eye tissue, and liver, and lung, and stomach. And so, running out of the possibilities to draw more arrows on this slide, I hope you get the message that stem cells are limitless and what tissue they can turn into. And I emphasize once again, they become a brand spanking new healthy tissue once they've decided what tissue they're going to become. Now, we might as well introduce a concept very early on in the stem cell awareness component of our slide program. The total number of stem cells actually matters. So you'll hear me bring this up over and over again, but in your education, you need to keep in mind of always being able to question how many stem cells are in that product. And it's quite obvious then that the greater number of the stem cells that are administered, the greater the potential outcome is going to become. Companies process these products with numbers between 1 million to 12 million cells per milliliter. Obviously, the more cells per milliliter, the better. Let's move on. Let's talk about what stem cells are not. And to do so, it's certainly appropriate to introduce the concept that stem cells are not, and I repeat, are not monolithic. So the word stem cell by itself really is pointless because there are various kinds of stem cells. There are places of delivering those stem cells. There are some cells that have a greater potential to develop into the tissue you want it to turn into. So the word stem cell cannot be considered as a word unto itself. It requires diving into to determine those other matters that I just mentioned a moment ago. All stem cells are not equal. Some stem cells can do a better job than others in certain tasks. You as a consumer need to know that and be armed with the ability to question on what kind of cells are being used. As your education unfolds, you'll understand better what I'm going to be referring to. At this point, there are two observations that can be made to sum up the current stem cell climate in the United States. The first observation is this: the public is confused about stem cells and really doesn't know it. Here's an even scarier observation, and I got to tell you, this is absolutely true and correct. The medical profession itself is equally confused, and they don't know it. Folks, that's not a good formula to spell success and accuracy. And I intend to be able to make you the educated consumer so that no matter what professional approaches you, you'll be able, through the questioning that I'm going to provide you, to find out if the stem cells that are offered are going to be the best choice for you. But because of this confusion, and as a result of it, the stem cell climate, you, the consumer, are vulnerable. And you're vulnerable to a well-intended medical community that doesn't appear to have the facts And by the end of our discussion today, you will have those facts, and I promise you, you will lose your vulnerability. Now, I call this course Stem Cell 101, but quite honestly, this could be called Stem Cell 201, 301, 501, or 901, because I intend to use the right nomenclature, and I would use this same discussion with a group of doctors that I'm using with you today. And then to point that out, I've already listed a set of vocabulary words that by the time we complete our discussion, you will at least have heard of and be familiar with. So I don't want to scare you with these words. I just want you to know they're coming. And when each and one of these words does appear, I will explain it completely at that time. Continuing now with our discussion, we need to spend a short bit of time on what can be referred to as the stem cell industry. At the present time, there are over 600 clinics in the United States who treat with stem cells. Next slide. These stem cell clinics in the United States, over 99% of them are using what are known as autologous, the first vocabulary word now, autologous stem cells only. And we need to find out what is meant by autologous stem cells. These stem cell clinics, the vast majority of them are dedicated to treating joint disease, the various forms of arthritis, patients that may need and have been advised to have joint replacement therapy. In fact, stem cells have now turned into be a very good choice so as to avoid joint replacement. Knees, hips, and shoulders are probably the most common joints that are asked by the medical profession to help correct, at least problems with it to correct. Stem cells are also used for breast reconstruction and used in very many aesthetic applications for facial rejuvenation. But this still begs the question, what are autologous stem cells, since 99% of those 600 clinics are using them only? Now here's your definition of autologous stem cell. And that is, these are stem cells that come from and go to the same person. So in a sense, the patient is both the donor and the recipient. When it comes to autologous stem cells, there are three sources where autologous stem cells can be harvested from. The first of these sources is the blood. The procedure is something called PRP, which stands for platelet-rich plasma. We'll talk about it in a minute. Another source are fat stem cells, which come from adipose tissue. And the third, bone marrow, which come from bone marrow aspirates that are able to be harvested. Talking about PRP first, when you take a blood specimen, if you distribute that into a test tube and then spin it down in a centrifuge, the heavier part, or the cells, go to the bottom, the plasma come to the top, and there's a buffy coat, this white blood cell and platelet portion right in the middle that you see on the slide. Just above that portion is a very rich area of growth factors and cytokines, which are helpful with stem cells, but there are not, and I repeat, there are not any stem cells whatsoever in a PRP solution. So in a way, they're really not stem cells at all, yet sometimes they are passed off and purported to be such. They do not have any stem cells in them. Adipose stem cells, as we see pictured here, are derived from a liposuction technique. What you see in front of you is a syringe, a 10 cc syringe used to suck out fat from the flanks of a cooperating patient. Various steps are then taken with about 60 cc's worth of fat, where you have to wash the fat, you have to centrifuge the fat, you have to collagenase the fat, around and around and around, multi-cycles, taking 3 hours to manipulate those fat cells until finally, as is seen pictured here in this slide, you end up with the smudge on the bottom of a test tube. Those, they say, are the stem cells. That is not completely accurate. There are stem cells in there, but there's certainly many other stem cells and only a small number of actual stem cells, and that has to be pointed out to you. The third donation point for autologous stem cells is bone marrow. The diagram you see in front of you shows a bone marrow aspirate retrieved from punching through the very thick pelvic bone and just drawing out bone marrow and sending it off to the lab to be processed. So now you've seen the three sources of autologous cells. Some more general comments to be made about them, however, is that these autologous stem cells that are used by 99% of all the stem cell clinics in the United States are only as good as the donor that they come from, and are subject to that individual's health status and age. With the age factor alone, let's reveal some very important information that you need to be aware of. And that is, after the age of 30, the stem cell content in any donor markedly decreases with that age. I want you to take note of this current slide. The picture of three women. They're actually the same woman. The woman as a child, an adult, and with the woman with the advancing age. With age as the only factor in mind, these next two slides, I believe, tell the story for why autologous stem cells more than likely are the wrong choice for you to consider. This first graph shows that based on the ages listed at the bottom, you see how high the stem cell content is up to the age of 5. At the age of 5, look at the drop-off of those stem cells between the ages of 5 and 11. And by the time the ages of 21 and 30 have rolled around, there are not many stem cells left. So if you're very young, these adipose cells, which are predominantly the choice of most of the clinics throughout the country, are maybe a good choice. But if with advancing age, they become a lesser able to help you with your particular medical issue. This next slide continues to reinforce that concept all the more. I want you to note, in a newborn baby, and I emphasize the word newborn for a reason, as you'll become aware of in the next few slides ahead, look at the number of stem cells in the newborn, and look at the number of stem cells in the teenager. There's not much difference between a teenager and a person that's 80 years old, in my opinion. But this is the problem with autologous stem cells when only the factor of age is being considered, let alone an unhealthy 35-year-old or an unhealthy 50-year-old. And anyway, I think you can see the story unfolding. This may not be the best choice for somebody with advancing age. These cells may be the good choice in the young, but not a good choice in patients with advancing age. Yet, and here's the punchline that really upsets me, even knowing all of that, 99% of the stem cell clinics in the United States utilize autologous stem cells only. Now, as we turn to the next slide, what becomes obvious to me is, as far as Stem Cell 101 course objectives go, you have now completed half of the course. And where you are right now is this. You've been made aware of the stem cell industry and how it works. You are now an educated and empowered consumer with the ability to sort through the many pitfalls of autologous stem cells, especially in those of advancing age, those patients of advancing age. You are rapidly, and I mean rapidly, losing your vulnerability. And now let's move on to the second half of Stem Cells 101. In the second half, we're going to be talking about another type of stem cell. These stem cells are appropriately referred to as heterologous. Now, I know it's a big word, but by using the actual word, you can never be stymied or confused by any professional that may be approaching you. So there were autologous cells when we discussed those, and now there are heterologous stem cells. And what are they? Well, by definition, these are cells that come from one human being and are given to another human being. The heterologous stem cells are derived from babies delivered by scheduled C-section in mothers that have been screened for various health issues. Now, I want to emphasize that these cells do not come from aborted fetuses. There are no moral, ethical, or religious issues with which to contend with. These come from scheduled C-section. The baby, once delivered, is handed off to the awaiting pediatrician, and then the surgeon delivers the placenta and the umbilical cord, and that's handed off to the awaited surgical team. I must say, by the way, the mothers are not financially remunerated for their donation, and the issue of getting the most vibrant source for stem cells is now on its way. Heterologous stem cells, and there's that word once again, get comfortable with it. There are two sources of the heterologous stem cells. The number one source to discuss is amniotic stem cells, and the second are umbilical cord stem cells. The amniotic sac is that membrane that completely surrounds the baby as the baby is growing in the woman's uterus, and literally the baby is floating in amniotic fluid loaded with these cells. But the baby is also connected to the mother through the umbilical cord, and these two components are able to be separated out from the tissue that's handed off in the operating room once the baby has been delivered. I should add also, by the way, that the umbilical cord and placenta are usually discarded as medical waste anyway, and so the fact that they have a more well-intended use other than as medical waste is actually making me feel pretty good about being able to use something that was destined to become worthless and now can be so worthy of benefiting the human race. Heterologous stem cells in this slide are now chopped up into that amnion or umbilical cord. What can be said about both of these sources is they have the longest, and here's a new vocabulary word, telomeres. We're going to get into that in just a moment. They have the longest ones. And these cells are immune privileged. Now we need to talk about that immune privilege component. They also are in the highest concentration of stem cells available from any known human source. And once harvested, they can be cryopreserved for longer than 20 years. And so whether you get these heterologous stem cells from the newborn baby's amnion or umbilical cord, when compared with any other donor of stem cells, there is no comparison to how vibrant, how energetic, and how juvenile cells can become, which makes them the better choice to help revive your old and worn out cells when trying to correct and rejuvenate your own tissue. Now let's get back to this concept introduced a couple of slides earlier on telomeres. What you have pictured in front of you is a set of chromosomes. And at the tips of each of the chromosomes, many times referred to as like the plastic caps of a shoelace, that particular portion of the chromosomes is called the telomere. And telomere length is directly proportionate to the age of a person. The longer the telomeres, the longer the life cycle of the human being that generates those chromosomes. When the telomeres, and each time they divide, by the way, throughout your lifetime, a little piece of the telomere breaks off until finally you're literally down to the nubs of the telomere. And once there, one of two things happens. Either those cells quit growing entirely, which is referred to as senescence, or they undergo programmed cell death, which is scientifically called apoptosis. They just die. So which set of cells would have more vibrant, more lengthy, more juvenile, more vital telomeres than those coming from a 1-minute-old delivered child? The other concept that was introduced earlier now needs to be explained, because you see, heterologous stem cells, meaning those that come from either amnion or umbilical cord, do not provoke a tissue rejection reaction like can occur with organ transplants. Every single one of you is very familiar with things such as heart transplant, lung transplant, bone marrow transplant. And in each case, these organs, once they're placed into the recipient, are immediately attacked by the recipient's immune system, and a rejection reaction begins that never really ends. There are, however, tissues in the human body that do not generate such a reaction. And the umbilical cord and amniotic sac are two such tissues. They will not provoke an immunological response, which makes them completely safe and unable to harm you, as would be the case with any other tissue that's donated by the human body. Heterologous stem cells, by the way, provide the greatest number. I talked to you about number in one of the earlier slides. I said numbers of cells is a very important concept to get into your mindset, and it needs to be a question you ask of anybody who attempts to approach you with the possibility of a stem cell therapy. And there is no better source for the magnitude of cells that can be harvested from the amnion, but for sure the umbilical cord. A more important question of the heterologous stem cells, which I find to be certainly a viable one, and that is, once they are harvested and before they are frozen, or cryopreserved as it's called, the majority of these stem cells are usually put as synthetic solution. One of the most common ones, by the way, is DMSO. And I will tell you, ladies and gentlemen, that is probably a mistake, and that we're going to be wanting to look for cells that do not have any immersion in any synthetic fluid at all because of the cell die-off that it provokes. Anyway, the concept will come up later. I mentioned it now just to be ahead of myself. So now, specifically with amniotic stem cells, as I mentioned, they come from the delivery of a scheduled C-section birth. Prior to the donation, the mother is screened for various health issues, and the picture shown in front shows the baby in an upside-down fashion, floating in amniotic fluid, and the amniotic membrane is carefully pointed out. You'll also see the umbilical cord connecting the mother and a blood supply from her to the baby, to the growing fetus, and a blood supply to it. Amniotic stem cells, there are a large number of stem cells that can be harvested. However, in actuality, very few get processed and are available for medical use. I don't know the answer as to why. I just know this needs to be explored and how many stem cells a product purports to have. And that amnion is immediately questionable because I never find that high numbers of stem cells are harvested. Maybe a product will be available someday where they are. Right now, there is not. The cells in amniotic fluid and amniotic sac, however, also have another downfall, and that they are exposed to major contaminants because the baby literally floats in this amniotic fluid. There is cellular debris, there is urine, there can even be fecal matter from the baby itself called meconium. All this is possible, and therefore amniotic cells could be considered as dirty cells. Amniotic stem cells are a good source of stem cells with those two issues in mind. However, I believe that with all those criticisms that are potential, they are not the best source. So what is? In my opinion, as it exists today, and what's available in the marketplace, umbilical cord stem cells, which are also harvested from babies delivered by scheduled C-section by those same mothers who've been screened for health issues, appears to be in the lead for the best form of stem cells that are available. As you can see pictured, and this is an actual picture here, a baby floating around in amniotic fluid. Look at the umbilical cord attached to the belly of the baby, and this is a sterile source. There are no contaminants. The blood supply is a direct one between the baby and the mother, unlike amniotic membrane and amniotic fluid, which you can never consider to be sterile. This is a cross-section of an umbilical cord. It's a diagram, but clearly you can see a few components labeled. First, running right down through the middle of that umbilical cord section is an artery. Encircling the artery are multiple umbilical veins. And then a strange word, one of your vocabulary words, appears also within the cord, referred to as Wharton's jelly. Wharton's jelly is just loaded with stem cells. And not only are they stem cells, they are a very special kind of stem cells, something that you're going to be learning about in the near future with these slides, called mesenchymal cells. But I just wanted to show you where the greatest reservoir of these specialized cells lies. And this resultant mixture of the immune privileged cells harvested with the white blood cells and the Wharton's jelly are harvested from. Here's another key point in your education. The key to producing a superior stem cell is that the product is how the umbilical cord stem cells are processed. And in bold letters, I say, and I want you to learn, that all red blood cells must be removed. I repeat, all red blood cells must be removed because residing within the red blood cell is the possibility for immune rejection and immune response. If you take the red blood cells out, the stem cells are completely immune privileged, but the red blood cells must be out, and then what gets processed is the Wharton's jelly and the white blood cells. So, umbilical cord cells are the best known source of stem cells due to 1, vibrancy, 2, just the sheer number and volume of cells that can be harvested. They are the source of the highest content of these mesenchymal stem cells, which I'm going to be talking about in the next slide, and this source is considered to be a sterile source. Now, I mentioned mesenchymal cells a couple of times. It's a large vocabulary word. I want you to be familiar with it. These cells can differentiate into all the cell types that you could potentially want your stem cells to differentiate into. They are considered, in quotation marks, the workhorse of all stem cells. The greater the MSC, the greater the mesenchymal cell content, the greater ability to regenerate and promote the formation of healthy new tissue of all types. This next slide happens to try to get that concept across, because in the center we see a mesenchymal stem cell, and then each one of the arrows shows what this one cell that starts out as blank could eventually become. And I tell you, I just run out of space for arrows and more pictures because the potential is limitless. And that's why mesenchymal stem cell content is so important. Now, here we are. We're at the completion of the second half of Stem Cell Course 101. And the following objectives have now been completed. Number 1, you as a consumer can now distinguish the benefits between autologous and heterologous stem cells. Based on your age alone, you can select the best stem cell source for you, keeping in mind that the very young absolutely can benefit from stem cells, but that those with advancing age, when that stem cell source is autologous, that really needs to be questioned. You see, all stem cells are not alike. And I believe you now have completely lost your vulnerability in making a stem cell choice. So now, ladies and gentlemen, as I had told you at the beginning of our discussion, we would ultimately come to what I refer to as your 7-point stem cell checklist. Now, I want you to go through with me. I want you to see what the checklist is to be able to use should you consider stem cells to be administered from any doctor approaching you with any product. If you use this stem cell checklist, you will be able to make the adequate and the appropriate decision for you. So let's find out what this 7-point checklist is all about. Also keep in mind that if you'd like to get a copy of this stem cell checklist, there'll be information on the end where you can contact us and we'll send you an actual copy of this that you'll want to keep with you and retain for your records. I believe this stem cell checklist will withstand the test of time. So here we go. The 7-point stem cell checklist begins with checklist question number 1. And that question is, are the stem cells that you're considering autologous or are they heterologous? And as you should know by now, over the age of 30, the autologous stem cells are not the best source of stem cells because the number drops off so enormously as you advance with age. That's checklist question number 1. Checklist question number 2. If they are heterologous, are they derived from the amnion or are they derived from the umbilical cord? And as I have already told you once, I now tell you again, that based on a number of factors, as it stands today and the products that are available in the marketplace, umbilical cord cells are potentially the best source of stem cells of any type that I'm aware of available. Checklist question number 3. If the stem cells are from the umbilical cord, are they processed to remove all cord blood? You must insist on the answer to this particular question. Are there red blood cells in there or not? And because if they're there, you have just lost your immune privilege, you cannot settle for a product in which you cannot verify that those particular types of cells have been removed. Because they are found in cord blood, they are not found in cord stem cells. The next question, checklist question number 4. What's the actual number of stem cells contained in that product? Now I want to insist that the actual, and I don't want to hear about estimated numbers. There's such sophisticated laboratory intervention available that actually is able to tell you the exact number. The higher the number of the stem cells, the more superior the product. And as a general rule, there should be greater than 10 million stem cells in a 1 milliliter vial. That's the basic minimum. Checklist question number 5. Have the stem cells been stored in any synthetic preservative? Because these stem cells are damaged and die off rapidly when stored in synthetic solutions. And I've mentioned that one of the most common ones, used about 90% of the time, is DMSO. But if it's synthetic, it cannot be considered to be healthy. Once the thaw has begun, and of course, the doctor receives these kinds of stem cells frozen, the moment the cells are thawed, complete die-off of these cells usually occurs within 15 minutes In fact, in the industry, these amniotic cells, which I know use these, as well as umbilical cord cells that do use synthetic solutions, are called zombie cells. Now, why do you think they call them zombie cells? They are dead, and that's why. Question number 6. What's the total mesenchymal cell content? Get familiar with the word, be comfortable with the question. Umbilical cord cells have the highest mesenchymal cell content. And you can remember the slide that showed all the different cell types that mesenchymal cells can differentiate into. This amount of the total cells should be higher than 30% of the total stem cell count. If you are told either you don't know or you're not sure, they're not sure, and they can't verify and prove they're above 30%, their use is considered questionable. Checklist question number 7. What's the total number of live stem cells after thawing? These better reputable companies dealing with higher refined products are able to know exactly how many cells survive in that particular batch. So there can be a considerable difference between the total number of live stem cells after the product has been thawed and the number of stem cells that were put in to be frozen. You want to ask for stem cell viability of the product. And that's usually expressed in a percentage, and you must demand that the viability of that stem cell product that's presented to you is in excess of 95%. If the answer is said to be unknown, then the stem cell product is questionable. Now, a final point to be made. At this time, there are very few companies that process umbilical cord cells to begin with. Even fewer that do it to the level of processing that will allow all these questions to be answered in the way I would like them to be. As we move forward, new products will be developed that will be better than those available in the marketplace today. The products may change, but the point I want to emphasize with you is the 7-point checklist that's used to select a product will not change. You now have that checklist. This checklist lives on. A year from now, 5 years from now, the 7-point checklist will still be the 7 questions to ask then as they are now. To be an educated consumer and not a victim of an aggressive sales presentation, use the 7-point checklist. So, ladies and gentlemen, you now have your 7-point checklist. Let me provide you with what I believe to be the ultimate question. And that question is something we did not even discuss here today, but that I leave you with to be able to identify the practitioner that may very well meet your needs. And the question is, how will the stem cells be delivered? To be most effective, the stem cells must be placed into the very tissue that are intended to be rejuvenated. This makes perfectly good sense when we're talking about the joints of the body. But when we're talking about organs of the body, I believe that direct delivery, this term that I literally invented to describe a process that I fully intend to be able to meet, the issue of direct delivery really needs to be discussed. When it comes to joints, most practitioners have the acumen and skill set to provide you with relief. But I know many of you are looking at issues regarding your own health history that really don't have anything to do with joints. It may be your vision. It may be the status of your heart. It may be the status of your liver, your kidney, and so on and so forth. So the issue of direct delivery is one that we would like to be able to discuss with you should you intend to contact us. This next slide then tells you where we're located. And by the way, at the end of this webinar, you're going to be given the opportunity to sign up for a free consultation with my staff to find out answers to questions regarding your own particular personal situation. Please avail yourselves of the opportunity to speak with us. If you have additional questions, you'll want to give us a call at 813-702-4415. And if you want to keep tabs on us as we move forward with some pretty great plans in the very near future, I want to invite you to go to the website at www.stemcellsolutionsofamerica.com. Now, as I close today, there are a couple of points that I want to leave you with. Point number one, you are now an educated consumer concerning stem cells. Number two, you have lost your vulnerability that you had on the way into this discussion. You leave us a completely better educated person on your way out. With your new education completed, don't be surprised that you actually know more about stem cells than the doctors who may be considering treating you. They really are confused out there, and that means nothing demeaning to them. It's just they've never had the opportunity to have it explained as you have had in these last many minutes that we spent together. Remember, the medical profession is confused concerning stem cells, and they know it. Next point. Frequently watch the webinar again and again to keep your level of understanding sharp. Review Stem Cells 101 just prior to making any decision regarding your choice of products and doctors. Point number 5. Continually refer to your 7-point stem cell checklist. And if you want a copy of it, contact us at 813-702-4415 so that we can provide you with one. Point number 6. Remember, there is a stem cell solution to your medical dilemma, no matter what that may be. All medical issues are potentially reversible and rejuvenatable. We just have to figure how to directly deliver those cells to where they will do their most good. And finally, remember, even if the stem cell product is superior, the stem cells need to be delivered directly to the organ or body part that requires a rejuvenation. Insist that direct delivery be addressed and accomplished. I want to thank you for spending this time with me. Hope to meet many of you in the near future. Goodbye now.